Well, hello and welcome to my presentation. I'll be presenting on mental health treatment within the juvenile justice system. So let's go ahead and get started. So an introduction into the juvenile justice system. So currently there's a growing concern, a social movement, if you will, on how best to treat the youth who are presenting with mental illness within the juvenile justice system. There's a rising advocacy for greater emphasis on mental health treatment services within this system. They're finding that not only is there a significant increase of incarcerated youth offenders, but this increase is connected to mental disorders. And so what do we do? We're going to talk about today, I'm going to talk about the 3 points you see on this slide. Prevalence of mental disorders among the youth in the juvenile justice system, effective treatments among this population. Effective treatments are showing, research is showing that evidence-based treatment, CBT treatment programs are of the best programs, the most successful. And DBT is sort of revealing as being the promise of, showing the greatest promise of working within this population. DBT was originally developed for suicidal women with borderline personality disorder, but since its inception, it has been successfully modified to use with other populations, including violent and impulsive adolescents residing in correctional facilities. So let's go ahead and take a look. Right now, we'll look at the prevalence rate of mental disorders. Mental illness among adolescent offenders. According to a recent study, approximately 50 to 75% of the 2 million youth meet the criteria for a mental health disorder, with 40 to 80% of these incarcerated juveniles, they're being diagnosed with at least one, sometimes two, but at least one mental illness. And the mental illnesses that are afflicting this population include affective disorders, anxiety disorders, disruptive behavioral disorders, substance use disorders, and that's just to name a few. Okay, so let's continue. And so now we'll talk about research of evidence-based treatments within this population, among the population. Research out there has shown that evidence-based treatments have been successful in correctional facilities, prisons, jails, these type of settings. And research indicates that many cognitive behavioral programs show success in improving attitudes, social skills, family and peer relationships. CBT interventions target distorted thinking associated with mental illness, such as anxiety, depression. It can target cravings with substance use disorders. CBT has been effective in challenging and replacing negative and criminal thinking, and it replaces it with accurate and objective self-appraisals. A recent study on evidence-based programs within incarcerated youths. One such study found 86 young men in a correctional facility. They took a sample of these 86 men and they implemented a CBT treatment program, and they compared it to the youth that did not participate in the program. And improvements in attitude and family relationships increased. There were improvements, significant improvements to the counterpart that did not participate in the program. All right, so moving on, we'll take a look at research with DBT. So again, as I said, of the CBT approaches, DBT is showing distinct promise for this particular population, for incarcerated youth. So the first study, Quinn and Shara, in 2009, what they did was an extensive literature review among Canada and US incarcerated youth populations among the juvenile justice systems within the US and Canada. And what they found was, of the programs, of the research that they did, of the different studies they investigated, almost all of them showed a reduction of aggressive behaviors of the youth. They showed reduced suicidal behaviors, a reduction of punitive actions by the correctional officers, and they did this study. It was interesting. They made a special note that they are advocates for DBT programs, and what they wanted to do was to kind of promote that how effective DBT is with this particular population, and they wanted to kind of like spread the word. Hey, we've investigated, we've done extensive research on all these different correctional facilities that have used this approach, and they're finding success. And they kind of want to get the word out that DBT should be more widely used within the correctional facilities, within the juvenile justice population. They make note, though, that the DBT skills should also be taught to these youth's families. They noticed that when the families were not brought in and when they were not kind of taught the different skills, there was a decrease in these kids continuing to show improvement. And they also made note that the staff in the correctional facilities also need to be taught the training of DBT training skills so that they can better implement. But other than that, they found just wonderful success. And then another study here on the screen, DBT intervention improved adolescent behavior while incarcerated. So Trupen et al. In 2002, they ran a study at Washington State Juvenile Rehab Facility, and they sought to answer a couple questions. Number one, will DBT intervention improve adolescent behavior while they're incarcerated? And will the participants decrease in risk assessment, in particular suicidal risk assessment? Will that decrease? And this particular facility contained, it was like a campus that had 3 cottages, and these female youths lived there. They're incarcerated. They were put into these rehab cottages, and so what they did is they assessed 2 of the cottages. They implemented DBT training programs, and then 1 cottage they left just as treatment as usual. They didn't stop treatment, but they didn't implement DBT. And what they found over the 10 months that they investigated, they found that the 2 cottages where they implemented DBT, there was a significant behavior problem reduction. So it did improve the adolescents' behaviors. It also decreased the risk assessments. Their suicidal assessments went down, the aggressive behaviors were reduced, and the cottage where DBT was not implemented, there was no change. So they didn't decrease anything, or they didn't increase in any negative behavior, but there was no significant noticing of decrease in negative behaviors. In the next study, Shelton et al. In 2011 investigated a correctional facility with males ages 16 to 19, and they studied a 16-week skills training program. And what they did was this correctional facility modified DBT's training modules, one of the skills training modules. They modified it to follow their program. So, and this is something DBT is so great at, you can modify the skills training modules. And that's exactly what they did. They wanted the daily experiencing skills to represent the program they had already in place. And so with this slight modification, they sought to find out if DBT improved impulsive behaviors. Was there a change in impulsive behaviors? And they found, yes, that there were, how many boys? 26 boys. 26 participants participated, and they found that, yes, their aggressive, impulsive behaviors were targeted, and there was a reduction. And again, they found the number of disciplinary actions by the correctional officers were reduced. So not only are the boys and the girls, and so far in all these studies, the incarcerated youth's behaviors are changing, but because they're changing, they're getting in less trouble. They're not, the correctional officers are not punishing them as much, which is good. So, all right, so that's the research on these, on using DBT in correctional facilities within the juvenile justice system. So now let's take a look at what exactly DBT is. So DBT is the first empirically supported treatment for individuals who present with unstable emotions, cognitive disturbances, self-harming behavior, chronic feelings of emptiness, interpersonal dysfunction, poor impulse control, and anger management. So DBT is a form of CBT, as I've mentioned before, and it was developed by Marcia Linehan, and it was originally developed for women who were suffering from suicidal ideation and who also presented borderline personality disorder. And again, it's been used with other populations. So what it is there's 5 stages to this form of treatment. And the first stage is always pre-treatment. And so that's not really stage 1, that's pre-treatment stage. And this is such a great time when it's sort of an orientation, and the client and the therapist arrive at a mutually informed decision of work, of what they plan to do. They come up with a plan and they work together. And after that, there's 4 stages, and they don't have to be done in linear order, but stage 1 is behavioral control. I have it here on the slide. It says attaining basic capacities. And what that is behavioral control. In order to build a life pattern that is functional and stable, clients need to learn how to control their behaviors. And stage 2, I have listed as quiet desperation. And what this is it's a reduction of extreme emotional pain. The client addresses goals and comes to learn how to accept their emotions and a process of reducing self-blame. And then step 3, or stage 3, it says resolving problems in living and increasing self-respect. And it's exactly that. The client learns how to resolve unacceptable unhappiness, problems in their daily life. They learn how to resolve these. And stage 4 is attaining capacity for freedom, contentment. And again, it's just that. Develop the capacity for sustained contentment. And then my next point here is, well, what is it? How is it to think and act dialectically? What does that mean? Well, that means to view the world in a different way, to accept that the universe is filled with opposing sides, opposing forces. There's more than one way to see the situation, if you will. There's more than one way to solve a problem. Two things that seem like opposites can both be true. And so it's this way to think. It's changing this thinking process where every person and everything is connected in some way. And you know, that change is the only constant. Meaning and truth evolve over time. Change is transactional. What we do influences our environment and the people in it. And as you can hear, that there's just this change in this thinking pattern, and that's how you think and act dialectically. You implement these skills of how to move forward in life using those. And so I've talked about the research is positive. The using the stages is a great way to work with these youths who struggle with this type of faulty thinking and impulsive behaviors. But what does it look like? How do we put this into place? How would a juvenile justice correctional facility implement this? Well, DBT is comprised of both group therapy and individual therapy. And group therapy focuses primarily on psychosocial skills training. And I find this very interesting because it's the only group therapy where if someone in the group is disruptive, they don't remove them from group therapy. They keep them there, and the client and the kid, the youth who's being disruptive, and the therapist and the group, they all work on this. They work on it together. They figure out how to handle this, how to find a distress tolerance in this. And so it's interesting. I love that idea where they don't remove the child as other group therapies would probably do. And so obviously that is perfect for this population. That would work well in this setting. And then individual therapy obviously works well as well. And it focuses on motivational issues, introducing the motivation to stay alive, to replace problem behaviors, to work to build a life worth living. And then I have a note here because I just wanted to make this distinction that research supports the effectiveness of DBT for both individual therapy and group therapy. So one is not better than the other. Research says both are successful. And just a little note here that they found that group therapy is indicated or is sort of promoted when social support systems are low. And so that tells us right there that this form of group therapy is a way of also building the social support system. They want to increase group therapy for maybe a young adolescent who doesn't have a family supporting, who isn't coming to visit regularly or, supporting his well-being or her. And so they kind of promote that group therapy for that little guy or girl. So what happens during therapy? What's going on? We talked about the stages, but also what happens in these stages is there's modules. And these functions of treatment are skills training. And so not only are they learning things in stage 1, 2, 3, and 4, but there's also 4 modules where they learn skills to help them in these stages. And one of the module training is mindfulness. And mindfulness focuses on the immediate context of what they're thinking about and how to accept what they're thinking without judgment. Interpersonal effectiveness, learning assertive skills, self-respect, relationship training. And then there's distress tolerance. This is like a self-soothing technique. And I mentioned that they teach this in group therapy as well, and how to have a hands-on, how to implement self-soothing techniques, how to lower this impulsive negative behavior. And then there's the next one, the 4th one, emotion regulation, behaviors and cognitive strategies, again, that help with behavior impulse control. So in conclusion, I have laid out just exactly how DBT, the application of it, how it works, its success rate. The research findings are positive among this population. This population needs effective treatment, and this is proven to work. And so I thank you for your time. I am going to scroll through just to show you if you want to look at the references. There are such great references out there I found so many great articles, and I've learned a great deal about this population and how we can effectively help them. Thank you.